Hello and welcome. Today we will be speaking about medication overuse headache. This is one of the commonest causes of headache out of all the headaches that we have. Now, did you know that 63 million people in the world are suffering from medication overuse headache, which means about 30 to 50% of all headaches that come to doctor are because of medication overuse. What is this and why does it cause? Now, whenever you have a headache, which could be because of any reason, it could be because of flu, because of sinusitis, stress, pollution, pain, or any other reason, what do? The first thing you do is you pop a pill. You just reach to your chest cabinet and you get a pill and you just pop it and you feel better for some time. And after a few hours, the headache returns back in a much more vengeful or bad form, as if it wants to get even with you. And probably what you could be suffering from is a medication overuse. Now, what are the painkillers that you could be popping? It could be as simple as something like a brufen or a paracetamol, or it could be aspirin, naproxen, it could be an opioid like tramadol, etc., or any migraine medication, or even simple medications which you take for cough cold like antihistaminics. All these medications have the capability of causing medication overuse headache. Now, in which patients is this commonly found? Generally, it is seen that women who are more than 50-year-old are at a higher risk. Probably patients who have had pain in the past and who are taking painkillers and who have decreased activity could be at a higher risk. Yes, there is a genetic component to it, but that is really not much. Now, why does this happen? Usually, when we are taking a lot of medications, the body suffers something called as tolerance. That means the body gets used to the medication. The receptors at a molecular level get used to the medication that you are taking. And this can be causing a rebound headache or a medication overuse headache. So how do you prevent it or how do you treat it? First and foremost, you have to limit the amount of medication that you take. Now, the medication need not only be medication, it could be caffeine. So even the tea and coffee that you take does have caffeine in it. And when you do not take tea or coffee, you find that you've had a headache after not consuming that for some time. So first and foremost, limit the medication use, limit the use of caffeine, consult your doctor, tell the doctor that you've been taking these medications and the medication gets worse after a few hours. Have good sleep at night, drink plenty of water. Have a good diet because there are certain triggers in your diet which could be causing a medication induced headache. And maintain a chill lifestyle. Just relax, use stress relaxation techniques, use meditation, and use alternative methods to decrease your pain. Do not use pill as the first line of therapy for your headache, because the pill that you take for your headache can cause a bigger headache. Thank you so much for watching.